My name is Stef Gayhart. I am a 5-year tongue cancer survivor. I was diagnosed in 2019 with stage 3 oral squamous cell carcinoma of the tongue. I was 37 years old at the time and a single mom to a 6-year-old little boy. I had a hemiglossectomy, so I had half of my tongue removed, some lymph nodes removed from my neck, and then I had radiation treatment to also treat the cancer that had spread to the lymph node in my neck. Yeah, well, funny story. I'm a nurse, so going into this, I thought that I would know a lot more than I did. Even though I didn't work in cancer, I worked in critical care. Um, but I left the treatment phase of my cancer journey with very little knowledge about what to expect from a physical, emotional, holistic point of view. It felt kind of like I was dropped off because I didn't get a care plan. I didn't get a treatment summary. I didn't know from radiation how much radiation I got. I didn't know what the side effects could be long term. And every time I brought them up, my concerns up to my providers, I really wasn't given a straight answer, or, I didn't have anything that I could take with me to remember and to write down and say, okay, well, what should I be looking for? What should I be asking about? What should I be concerned about? So when I started doing work with NCCS and I learned about care plans and I started working in the cancer community, I was like, oh my gosh, this would have been a life changer for me because I just felt so alone and so unprepared for what was going to come next. In a care plan, they have usually there's a treatment summary, so you know exactly what happened. And for me, that would be radiation dose, how many fractions I got, um, how many doses I got, what the total dose was, and then also follow up appointments, what side effects to look out for, what types of problems to look for in the future, different types of cancers to screen for because of the treatments. And all of that is beneficial to the patient, obviously, but also to their other clinicians because you can't see your oncologist forever. In my, at least with my type of cancer, there's a cutoff point, and I never actually saw my radiation oncologist again after my treatment. So, um, it would have been really helpful because there's so much fraction care in the healthcare system as it is. So all of these different things that happen, having that piece of paper, that literal piece of paper, to go with you to other appointments to help you, the patient, describe to the physicians what could be happening, but also so they have an understanding because there's so many different types of treatments and cancers and different people are affected in different ways. So having your own personalized little roadmap is really, really beneficial. I think head and neck cancer survivors should ask a lot of questions about long-term side effects from the treatments, whether they have surgery, radiation, chemoradiation, because it's a fairly rare cancer. We don't talk about it a lot in the medical community, so a lot of those effects aren't known. So having that care plan is something really important to advocate for, to have with you along your journey so that when you do experience something that could be part of your cancer treatment, you can bring it up to your other physicians, your clinicians, and private providers and say, is this from my cancers? Is this something I should go back to my oncologist for? Is this something I can handle somewhere else? And having that contact information from your oncology provider is really beneficial so that they can talk to each other and try to come to the best possible solution for you as the patient.